Indiana's top leaders tonight are in a fight with the federal government over vaccine mandates.
The administration released its final plan this morning, and it basically says you're required to get vaccinated if you work for a private company that has 100 or more workers. If you don't get vaccinated, then you'll need to get tested weekly, and you will have to cover the cost of that.
Now, those companies have until January 4th to meet these deadlines, or they could face thousands of dollars in fines. Indiana's Attorney General is now joining more than 24 other AGs in a lawsuit against the federal government. Governor Eric Holcomb said today he backs that decision by Todd Rokita.
In fact, the governor issued a statement this morning saying in part, quote, "This is an overreach of the government's role in serving and protecting Hoosiers. While I agree that the vaccine is the tool that will best protect against COVID-19, this federal government approach is unprecedented and will bring about harmful, unintended consequences in the supply chain and the workforce."
Now, there are some workers who agree with this vaccine mandate.
Others are protesting it.
I don't believe that the government has any right to be involved in my medical decisions.
Anything that we can put in place that's going to make people feel more secure to come and visit my store is the best thing for my store.
The White House says more than 3,500 businesses, hospitals, schools, and local governments already have some similar mandates in place.
Indiana Senator Mike Braun is leading about 40 Republican senators tonight, including Senator Todd Young, as part of an effort to oppose this mandate. They're using the Congressional Review Act to challenge it. They're not expected to succeed, but this effort could hurt some Democrats who are now up for re-election.
The Marion County Public Health Department is now giving COVID vaccine shots to children here as young as 5 years old.
The first clinic opened just 2 hours ago at the Northwest District Office, and that's not the only place.
These clinics are going to move around the city, and they're going to do so on a weekly schedule. For the very latest tonight, Rich Nye joins us live at the clinic that's on Michigan Road, and that's where parents have been bringing their kids to get vaccinated all afternoon today. Rich?
Yeah, Scott and Anne Marie, you saw those long car lines at the Indianapolis Motor Speedway Clinic yesterday. We've seen a steady stream of parents and their kids here today at the Northwest District Office on Michigan Road to get their COVID shot. But the lines have not been too bad. In fact, walk-ins are welcome. 10-year-old Lincoln was excited to be among the first kids in Marion County to get his COVID shot. He never got sick, but has been quarantined 3 times for contact tracing.
Why do you think it's important to get a shot?
So things can start going back to normal.
Have you seen COVID impact anybody in your family? Has anybody gotten sick in your family?
My mom once.
Lincoln's mom is a primary care physician who got a mild breakthrough case of COVID.
I've seen a lot of COVID. I know what it can do to people. I'm excited for him to be able to have the vaccine. He can do more things. He can protect himself. We will protect his grandparents. We will protect everyone around him. I think the more people that get vaccinated, the better.
The Marion County Public Health Department had 100 child-sized doses available on the first day of their clinic, now open to kids 5 to 11.
This is such a critical tool for the protection and prevention of serious COVID-19 infection in our children.
2 more doctors' kids, Mary Beth and Cameron, also were walk-ins for the first of 2 doses of the COVID-19 shot.
It felt like a little pinch, but it was really fast.
Their father is a trauma surgeon.
Mary Beth actually called me while I was at work on Tuesday when the word came down that kids were going to be available and asked if we could go on Wednesday morning. And so she's been itching to get this done for months. And so when we finally got the word that it was going to be available for kids, it was more an issue of making sure that they didn't leave school early on their own to go somewhere so that we could get this done and taken care of.
Awesome.
And this clinic is open until 7 o'clock tonight. Right now, I see no wait in the lobby. These vaccine clinics are going to move around Marion County on a weekly schedule. Tomorrow's clinic is from 8 a.m. until noon. That's at the South District office on Shelby Street. Again, appointments are encouraged, but walk-ins are welcome, and you can make your appointment on the statewide shot. Again, that's ourshot.in.gov. Not many appointments available as I checked it out today, but you can walk in.
Yeah, good to know. Rich, thanks so much.
Vaccine shipments are still arriving at hospitals around central Indiana. IU Health's Riley Hospital for Children sharing these images with us. This is the arrival of their first shipment.
Now, it only includes 300 child doses. Pfizer is expected to send these smaller doses throughout the weekend and into next week. And that's why it's so important that you make an appointment for your child to get the vaccine.
Many clinics say they prefer it right now since the supply is so limited. So keep in mind, you can sign up and you do so through the Indiana State website.
Here's another way to do it. Just text the word vaccine to this number, 317-655-5740, and we'll send you the latest stories that we have, including all the links to sign up for those appointments. Moderna is tonight warning its vaccine shipments are falling short of expectations, so the pharmaceutical company is focusing on getting doses to low-income countries. Moderna has been dealing with production and shipment issues. It was expected to ship up to 1 billion doses this year, but some of those deliveries will now be pushed back to next year. Britain becomes the first country in the world to approve the first COVID pill treatment. This is the pill developed by Merck. Their CEO, who's a Franklin High grad and former Lilly employee, says they're seeking emergency use here in our country. U.S. advisors are set to discuss that topic this month. Merck has said it'll have 10 million courses of this pill treatment ready to go by the end of this year.